Hi, this is Dr. Michelle O'Donoghue reporting from Medscape. Joining me today to talk about artificial intelligence and possible implications in healthcare is Dr. Ami Bhatt, who is the Chief Innovation Officer at the American College of Cardiology. Thanks for joining me, Ami.
Thanks so much for having me.
Your background is an interesting one because you trained in adult congenital heart disease and practiced in that space for many years. And that was before assuming this role in as chief innovation officer. So, what drew you to that particular position?
Yeah, it's always nice to be able to draw a line once you're looking back. You never know what that line's going to look like looking forward. So, adult congenital heart disease, gray field, subspecialty, young patients who at the time were using FaceTime to talk to their family and friends, and oftentimes don't live in a big city near an institution that's a tertiary institution. And so they actually started asking me, "Hey, doc, can't we just FaceTime? If we're just going over my results, why am I coming in?" All valid questions. So when the Mass General started to use telemedicine for stroke care, trying to really help institutions that weren't as familiar with it get patients care faster, I asked if I could have a license to try it out, and they were kind enough to let me. So 15 years ago, I started to experiment in it. And in 2013, I started every Wednesday a telemedicine clinic for my patients with congenital heart disease who lived far away. So that was really, it was my patients who kind of drove me and led me to it. And then what happens is you realize I don't have hands on this patient. And so very quickly as a young cardiologist, you think, okay, how do I get an EKG out there and get it sent to me? How do I get images? What does a stethoscope do for me? In adult congenital, the sounds of the heart are so important. And so then I started foraying into digital health kind of before it became a thing in very early versions because I realized that I needed more than just their face and their words from their home, but I sometimes would need data.
What got me interested in this space was also just a simple conversation I was having with the fellows and the junior faculty about how they're using AI in their lives today. Some of these tools like ChatGPT. And I have to say that I was just completely ignorant about most of what is currently available out there. So maybe just starting with the basics, because I think a lot of people hear the term AI, they don't really know what it means. But it's really a very broad term. I mean, in terms of healthcare implications.
AI has been around for a long time, in fact, in medicine. Radiology is probably the most commonplace, and that's a form of AI, machine learning, which is really for the most common example is take an X-ray, right, and show a ton of X-rays to the computer. This is a pneumonia. This is also a pneumonia. This is a pneumonia, and eventually the computer can say, "I can identify a pneumonia," and then do that with whatever you'd like to do with. The more modern one that you just mentioned, the generative AI, had not been as easily accessible to us until more recently. And it's really taken off because of the user friendly nature, if you will. And I'll give an example. I went out to Worcester, Massachusetts, where we had fifth graders in a STEM program. There's a nonprofit, Girls Inc., that helps teach them. And I was going there to teach them AI. And what I learned as we started working together, I said, let's do a demo. And I was typing, and one of the girls just came up to me, one who hadn't been paying attention, by the way. And she said, "Would you mind, doctor, if I did this?" She sat down, and the way she could generate questions from a chat GPT, the way her brain worked, the way the kids responded to her, they were really facile. And so I love that you said what you're learning from the fellows and residents and med students, because that generation is learning things far faster. And I will say the fifth graders, I have a sixth grader at home, they're native to this, right? This is intuitive to them. This is how they think. So I think the future generations are going to have an even easier time using AI for a variety of these things than we do. But when I think about it, I kind of think about three areas for healthcare. I think about administrative uses, and that's where this generative AI, or also called large language models, are really helpful. Um, let's take an example in the office. You and I both been practicing a long time. As computers came in and EHRs, we started doing more of this, being away from our patients. And I think it's really important to be looking at our patients. And so voice to text, I talk, my note gets written, then I can edit it. That's a big way we're seeing the use of the generative AI in the clinic. Writing insurance notes. You know what needs to go in there, teach the computer to go find it in the records, have it do a draft, again, edit it, or billing. So I think that administrative side is maybe where we're seeing the uptake the most. It's also a little bit the safest place because it's a draft. You can edit it. It's not doing healthcare. So maybe that's the first category, and I'll stop there.
As you say, that there is certainly a generational aspect. But there are a lot of people who just feel the concept of AI. It has many negative connotations. But I think, as you're nicely highlighting, there are many ways in which it can improve our quality of life as practitioners right now. Some of the fear is perhaps some of the changes that occurred along the way that are not necessarily AI related, but things like electronic health records. Some of it has made our lives a little bit more challenging rather than making things more streamlined as was initially hoped, perhaps. So I think the fact that there is so much administrative work that is now required in our jobs, this is sort of the right now what I think is the most useful current usage of AI in many ways in healthcare today.
I agree completely. I think there are areas where people are concerned. So, for example, the most common thing is the AI going to make a decision for me or my health or my patient? And so we think about that a lot. And one of the things we're doing at the American College of Cardiology is instead of saying we can give you decision support, it's can we navigate you to the right information at the right time? Because that's the next natural step in using AI is there is so much information available for any disease that you're treating in your patient that realistically the time it takes to find, source, parse through the information, apply it appropriately is not the 20 minutes of a clinic visit. And so, can we use the computing power of AI analytics to say, can you find me everything that's relevant? And can you summarize it for me? And then I'll use my clinical acumen on top of that. And so, really, it's navigation of information rather than decision support. And so, if we think about it that way, it's less scary and it's actually more helpful, just like you were saying, to actually ease the burden for the clinicians and to allow them to spend more time really talking with their patients rather than, again, turning away and facing a computer. The other area that people are worried is this area of imaging, which is if the AI is going to read the scan for me, what's my job? And I think it's important to recognize that edge cases, nuance, the clinical relevance, and all of the setting around an image or an image test, that can't be taken in by AI yet. So there was always going to be the need for humans. That then leads people to think, but then am I gonna have to do more work because it goes faster? As you talked about wellness, there is burnout. And I think for that, one of our favorite examples is a project that we're doing looking at ultrasound in the hospital. Right now, if you or I will read, let's say, an echocardiogram or a CAT scan, we'll read the ones as they come in order from the hospital. But the AI could find the next most dangerous one, pop it up in your list. So you're actually helping the next sickest patient in the hospital as you read the next study. And so I think those kind of things make us feel really good about our job. I'm helping a patient sooner. I can get on the phone and call them because I have the time to do it because the AI is helping me with my read. So I'm using the time wisely. And then you have to think about fiscal, right? So somebody's got to buy the AI. But in the same vein, if there are normal ultrasounds and people waiting to go home to their families, people waiting to go home so someone else can come to the hospital in their place, we can also identify those and we can help the system be more efficient. So we have to really just change the way we're thinking about using AI and make sure we're keeping the patient, the clinician at the center. And then you see a lot of really great use cases.
I think, as you're saying, the more we think about AI as an assistant rather than necessarily a threat to our careers, because there are so many opportunities, as you say. One, I think you led off by highlighting if it could efficiently synthesize a patient's medical history for us. I think that would be a tremendous help to most practitioners. When we have patients who come in with a chart, that's as big as a dictionary, it is helpful if there is some tool for being able to pull out what is really the salient information. I suppose the question is how much with time will it evolve to a place where it could functionally replace the need for an actual clinician to interpret the data. And I say that perhaps Right now I know that when I'm looking at electrocardiograms, a lot of call it AI. The read that pops up at the top is very often erroneous. I get that. But with China, with these machine learning possibilities, one could imagine that especially in areas that are underserved, in countries that don't have as much access to healthcare, that there may be a reasonable opportunity to improve access to care through some of these automated types of approaches. Oh, what are your thoughts on that?
If you think about cardiovascular disease burden globally, it's only going up. There will be more patients with more disease. And if we really just look at our workforce, it's going down. And so we have to rethink what workforce means. And if you include people who come from all different walks of medical life that consider themselves caregivers, community health workers, sometimes it's family people, definitely pharmacists and team members, if we can upskill people using AI, if you can give them information or give them guidelines, anything that helps them better understand how to care for somebody, when to refer them to more care, when they might be safe, I think that's a great use of AI. And that is going to help those communities that are underrepresented in getting better care. I still don't think we're at automation, but I do think that we can upskill the people who are available and very interested in giving care, but maybe haven't had the same training by offering them AI. The other place is in testing. As we use AI to help diagnose based on tests, then we can also upskill people because it's challenging. How many echocardiograms do you do before you become an expert? But if it tells you hold that position, you're getting a great image. That's going to help someone diagnose something because we see it with the AI. I think there's so many different ways that AI again can be an assist in underrepresented areas, to really be able to say we're going to use our workforce to the best of our ability. We're going to enable people to give the best care that they can.
Yeah, and I don't object to the idea that, as an additional check, perhaps, that if AI was able to offer alternative diagnoses, something I could have missed. I think that a lot of people would actually value having that sort of safety net in place. But I think again, the concerns perhaps are surrounding the idea that some of our rules will be actually phased out. So, what do you say to those people who are, sort of seeing the future and are fearful that that's the direction in which we are headed as physicians or as other types of healthcare providers?
Yeah, at the rate that we are really working hard on thinking about AI governance and regulation, um, at the pace that AI changes, and the AI of 6 months from now will not be like today's, and the AI of today is nothing like what was there a year ago. I think it's going to be a long time before we can trust what we've referred to as AI to take somebody's job. And I think that's where the job security lies. I used to tell people you'll always be necessary, but you have to be more specific about it. AI will keep changing, and therefore we will keep needing to test it and use it, and we will always need experts in the foreseeable future to be able to test, use, and ensure people's safety. People trust humans. People who know a lot about AI and science maybe trust AI more because they know that the amount of errors that a human can make when they're tired will increase, but AI is not going to tire. But AI has its own problems that can occur. So at the end of the day, I think the human AI collaboration, we call it collaborative intelligence at the ACC, that is the only way to safely move forward because the field will continue to change. There's nothing static about AI. I think moving forward change is the new normal, and that therefore requires collaborative intelligence for us to continue to provide the best kind of care for patients as we move. If you ask me what I'm really scared of, it's that we have only seen the tip of the iceberg, maybe not even seen it yet in healthcare, of cybersecurity risk. And that's probably what worries me the most is as we start to scale, it's one thing to do pilots. As we start to scale, how are we measuring? How are we keeping our data safe? Do we know that every time we change a certain thing, what increased risk did we expose ourselves to? And I think the rest of the world, the banking world for sure, right? The business world is aware of cybersecurity risk. Healthcare is aware and we talk about it, But the clinicians who might be using the AI, we have no training or understanding. I don't think it works that way. I think we're going to have to understand something more about risk than we did before. And so, if you really ask me what I'm scared of, it's not that people will lose their jobs, but it's that we need systems and infrastructure to measure if AI is doing what it was supposed to do, to measure if outcomes are better with AI, and to ensure that we're not putting people at risk. And I don't just mean privacy data, I mean people kind of messing with the algorithms or the algorithms changing. So there's a lot of learning to be done. I don't think anybody's going to let AI run without the clinicians in the middle just yet.
Well, thanks, Amy. I mean, it's a very exciting space. So thanks for walking us through that. I think ultimately to say right now, for really all healthcare providers out there, we can't just turn a blind eye. I mean, I think we have to be willing to understand how we can incorporate artificial intelligence, machine learning into our practices. And I think we've highlighted that in many ways that could be beneficial in terms of being able to streamline our time. But I think, of course, concerns will continue to exist, and we'll have to see how things play out over the next several years. But thanks for taking the time to chat with me.
Thanks so much for having me.
Signing out from Medscape, this is Dr. Michelle O'Donohue.